Are you worried that you may be on one of the medications which can increase your risk of developing osteoporosis? Let's review the list of medications which are most important to understand in order to prevent osteoporosis. My name is Dr. Kundlas and I'm a primary care physician for the last 25 years. First class of medication on this list which can predispose you to develop osteoporosis, we call it glucocorticoids or steroids. It goes with the common name prednisone, cortisone, dexamethasone, hydrocortisone. These are beautiful drugs which are used for many conditions, but unfortunately one of the side effects they have is developing osteoporosis. Second class of medication is anti-seizure medications. If you are on older medications like phenobarbital, phenytoin, tegretol, or Depakote, you are maybe at high risk of developing osteoporosis. These days we use Depakote a lot in mental health, so make sure you talk to your psychiatrist that if you are on a long-term Depakote, if they could change it to different class of medications. Third in this category is proton pump inhibitors, or we call PPI. They go with common names like omeprazole or Prilosec, Nexium, Prevacid. All of them in their class can put you at high risk of developing osteoporosis. You shouldn't be taking these medications on long-term basis anyway. Talk to your primary care physician so they could modify your risk factors and also can give you some alternative which may be safer than what you are taking. Number fourth is antidepressant, the SSRI categories like Prozac, Zoloft, Paxil. They are also shown to increase risk of you developing osteoporosis. Number fifth is the medication which we use after you have breast cancer in order to prevent the possibility of the recurrence, which are like Armidex and Femara. All those medications you need it because I will treat your osteoporosis any day rather than taking an increased risk of developing recurrence of the cancer. But make sure you talk to your oncologist and they will adjust your medications. Other classes of medication, if you're on a blood thinner like heparin, which we don't use it these days too much, could lead to osteoporosis. Certain medications like chemotherapy medications, methotrexate, which we use in rheumatological diseases and a lot of cancers, can put you at high risk to develop osteoporosis. A few diabetic medications like thioglutathione, which we don't use it in that much quantity these days because we have safer medications available, they also can put you at high risk for developing osteoporosis. One of the medication which is not talked about a lot is your thyroid medication. If you have hypothyroidism and you are on thyroid medication like Synthroid or Levoxel or Armour-Thyroid, you must take this medication in a very therapeutic range, meaning you should get it checked very frequently. If your levels of these medications are running more than it should be, you are at risk of developing osteoporosis. I hope this list of medication provides you some insight, certain medication which could put you at high risk to develop osteoporosis. My name is Dr. Kundlas and I will see you in next video. Please do not forget to like, share and subscribe to our channel. Thank you very much.